We're really excited for today's Bulletin brief to welcome Dr. Lyndsey Kilgore, who's an assistant professor of surgery at the University of Kansas. She's also the incoming chair of the Associate Fellow Committee of the Resident Social Society of the American College of Surgeons. So welcome, Dr. Kilgore.
I'm just so excited to be here to speak about advocacy, especially since my journey in advocacy actually started with you, Dr. Mammen, when I was a medical student. I mean, you're the one who brought me to the annual meetings, who brought me to the Hill, and then even had me apply when I was a resident for the scholarship. So just thank you so much for inviting me to be here. Everything kind of comes full circle.
Well, Dr. Kilgore, it's really quite amazing what you're doing in advocacy right now, and I'm glad that you got involved so early on. Clearly, it was a right decision to invite you to the Advocacy Summit all those years ago. So today we're here to talk about your recent Bulletin article, which I thought was really intriguing and really important for our members, which is really to talk about advocacy and specifically getting started in advocacy and health policy. The details really being about how the American College of Surgeons can help with their advocacy efforts. So tell us a little bit about how you picked this article topic.
Yeah, so the Associate Fellow Committee, we were thinking of ideas of, what's important right now, what's out there, what's trending, how can we be involved? And so advocacy is always an issue that's on everyone's minds, but no one really knows where to get started. And I think that a lot of us on the committee were thinking, well, I know of this, but I don't know if I should get involved or how to get involved. And so the topic came up because we thought, well, if we're having these thoughts and we're actually really involved in the American College of Surgeons, I'm sure other young surgeons out there are looking for ways to get involved as well. And so we really wanted to tailor it initially to young surgeons, those starting out their careers or those in training. And it branched from there because we know that you can get involved as a medical student all the way up to later years of your practice. But a lot of our focus was on the young surgeons since that's what our committee is.
You referred to the Associate Fellow Committee, and I kind of briefly mentioned it in the introduction, but I imagine that many of our viewers are not familiar with what Associate Fellows are. I think it's probably one of those categories in our membership in the college that's perhaps the least known. Could you explain a little bit more about what are Associate Fellows and a little bit more about the committee?
Yeah, so we're a younger committee, and we've only been around for a couple years now. But the thing is we're the people that are in between. So we are not residents, but we're not eligible to be FACS yet. So we're the in-between members, the younger fellows is the way to think of it, that are new in our practice, who are waiting to obtain FACS status. So we're that transition group, and before we had been forgotten about. And so this way, this committee brings to light the issues that pertain to us.
Right. And a very important transition, of course, from being a trainee to being fully in practice. So I'm really glad that the committee is really focusing on this area because it's an area where I imagine there's a tremendous amount of need, both in terms of education as well as support. And part of that need, of course, is learning more about advocacy. And tell us about how the younger fellow, or maybe not younger fellow, can really learn more about advocacy. What resources does the college have that you found?
Yeah, so we were surprised. There are so many resources out there, but not everyone knows how to get to them. And so our article helps summarize it. The ACS has an entire section dedicated to advocacy, but then people get overwhelmed when they go to the website. They're not sure what to click on, what organizations to be a part of. And so we really tried to summarize every single different organization that there is out there so that you can decide the way that you think you want to get involved, whether it's through policy, healthcare policy, or it's locally, or if you want to get involved at a national level, reaching out to Congress members. We have links on how you can click to set up meetings with your own congressmen and women. And so there really is a whole toolbox of resources. And actually one of the resources that the American College of Surgeons has is called Advocacy Toolbox. And so I just don't think people know how many great resources the American College of Surgeons has. And I could spend over an hour going into every single one of those different resources, but really it's, knowing that it's there and then finding it and going out and looking at it.
So you're clearly quite involved in advocacy and really have availed yourself of a lot of these resources and events. Which one have you found to be the most impactful? Your participation in what area or what tool have you found to help you the most in learning more?
So I think it's great to have the online resources because all of us have busy schedules, especially in our early careers as young surgeons. what my free time isn't the same as someone else's. And so having those online resources that I can go reference, I can see, the bulletin brief about advocacy that comes out, bi-monthly. I can get the summary when I need to and when it's convenient for my time. But really what I've enjoyed is the Leadership and Advocacy Summit. And I think that that's an amazing way for all of us who are interested in advocacy to get together and to advocate as surgeons for us and for our patients.
I know there's a lot of information out there on the Leadership and Advocacy Summit, but perhaps some of our viewers are not familiar with the event. Can you briefly describe your experiences at the Leadership and Advocacy Summit?
The Leadership and Advocacy Summit is an annual meeting in Washington, D.C. that the American College of Surgeons hosts. It's a comprehensive and specialized sessions that pertain to effective surgeon leadership, as well as advocacy training. There's different breakout sessions, different guest lecturers, and they really focus on the current hot topics in advocacy that we are fighting for on the Hill and that we're fighting for locally. Also at this, advocacy and leadership summit, it's a way that we can come together and learn from each other and see what other people are doing with regards to advocacy. So, I really enjoyed it because I was able to meet other people from other states, hear what they're doing locally and nationally. And then I was able to get involved in that as well and then bring it back to where I'm from in Kansas at our local level. So, I participated in it as a resident and then have participated as a young attending, but it's offered even to medical students. So everyone can get involved in this if they want.
And I believe there are resident scholarships as well, which for residents, if you happen to be listening, I think that could be a great opportunity.
Yes, I was actually one of the recipients back then. So it was a scholarship and it was paid for by the American College of Surgeons and was a great way to network and to get involved early. And that's how I found one of my passions for advocacy.
That's fantastic. Well, that's certainly a lot of federal advocacy. I believe they also talk briefly about state advocacy there, but can you tell us a little bit more about how maybe individuals can get involved at the state or local level if they don't feel as comfortable at the federal level?
Yeah, I think it's great. I think that, some people don't want to start big on the national level. And like I said, it can be daunting. Hopefully after these resources from our article, you will think it's a little less daunting. But the local level is great too. And I think that what we say is that you need to reach out to your local chapter. Each chapter is involved in different things with regards to local legislature and getting surgeons involved. So, in my local chapter, we go to our capital once a year. We go with other medical specialties, not just surgeons, and we advocate for local issues and bills. And I just think that from a local standpoint, it's a little less daunting, but you just need to reach out to your local chapter and how you can get involved.
And I imagine every chapter is a little bit different on their degree of involvement. And certainly if your chapter doesn't have something, I can suggest that maybe getting something started. I think the American College of Surgeons also provides perhaps grants for certain chapters to be able to expand their advocacy efforts. And I think that could be another great opportunity as well. If there was something, Dr. Kilgore, that you would suggest that someone who wants to get involved could do today, one small thing they can do to begin that advocacy journey, because it is a little bit of a journey, I imagine, to learn how to be an advocate. I certainly, it took me a while to really learn how to even do the very basic steps. What would you recommend that they do? What small thing could they do even today?
I think first, if it even just sparks your interest, is to read our article. Then we have listed all the different organizations such as HPAG, HPAC, CRC. So depending upon if you want to get interested in coding and billing or healthcare policy, what your interests are, you can go to that organization and they have monthly meetings, bi-monthly meetings, ways that you can get involved, or even just joining surgeon packs. And reading the daily or the bi-monthly bulletin brief. That's the best way that you can get involved right now, is just to know what's going on. Then when you find something that sparks your interest, you can see if there's an avenue to get involved that way.
You also mentioned in your article about the PAC. Can you tell us a little bit more about the PAC, why that's important, and how individuals getting involved in the PAC?
Yeah, so when I was a resident, I didn't really understand what the PAC was and why are they asking for me for money? What does it do and where's my money going? And the PAC is actually where surgeons can give us up to a certain amount of contributions, where those hard dollars are used to advocate for our issues on the Hill. And it's non-bipartisan, and they contribute to both parties or multiple parties to support different topics for surgeons.
And residents and associate fellows and fellows can all contribute, right? There's not a limit, I don't believe.
No, there's not a limit. And we actually really encourage you to participate. There's usually a gathering when we are able to meet in person at the annual meeting. And so I'd recommend that you guys, if you donate, come participate, come visit with us at that PAC meeting, and you'll hear what we're doing and you'll see where your dollars are going and why it makes such a difference.
The article is really great, covered a lot of ground, and I know we've touched on a few points. Anything else that you would like to highlight, Dr. Kilgore, that we didn't cover?
I want to say that I know it can be daunting to get involved in advocacy when you're a busy resident or starting out your new career. But that's why we wanted to show you that there's lots of different avenues and ways to get involved. You're not just going to hit the ground running with advocacy, but find one thing that sparks your interest and then try to get involved that way. If you're not out there, if surgeons aren't out there advocating for ourselves and our patients, then someone else will be who may not have our best interests at heart.
Well, thank you very much, Dr. Kilgore, for your time, and really, again, a fantastic article, and I think it'll be a tremendous help for a lot of individuals who are wanting to learn more about advocacy.
Great. Thank you so much. I hope you all will get excited about advocacy like I am.